Welcome back to Wellspring Midwifery's video library. This is midwife Liz, and today we are going to talk about all the different options for genetic screening. What are they looking at? What did they do? How did they differ from each other? Let's talk about it. Genetic screening describes different tests that help us to understand if a baby might have a genetic disorder. There are several different types of genetic screening tests, and each one is a little bit different. We'll talk about the 5 main options for genetic screening, plus a bonus option. Let's break them down. The first option is called Noninvasive Prenatal Screening, or NIPS. You may also hear this called NIPT or cell-free DNA. This test looks for chromosomal conditions like Down syndrome and a few others. This test can be done as early as 9 weeks into the pregnancy and can be done at any point in the pregnancy. It involves a simple blood draw from the pregnant parent, and at the lab, they're able to look at tiny pieces of DNA from the placenta from this blood sample. It's very accurate and correctly identifies about 99% of cases of Down syndrome, also known as trisomy 21. There's a less than 1% chance of false positives. False positive is when the screening test tells us that there's an increased chance that a baby could be affected, but the diagnostic test confirms that the baby is not affected. A very low false positive rate is a good thing, and this test has a low false positive rate. NIPS can also tell us about the sex of the baby based on the baby's chromosomes. It doesn't tell us anything about neural tube defects. NIPS is the most modern test, and so may not be well covered by all insurance plans. Next up, we have the first trimester screen. This is a well-established, fairly old version of a screening test, and it's done between 11 and 14 weeks. It includes both a blood test and an ultrasound. It checks for Down syndrome and another chromosomal condition called trisomy 18. It's not as accurate as NIPS. It correctly identifies about 85% of cases of Down syndrome, and there's about a 5% chance of false positives. Just like NIPS, it does not check for neural tube defects. Next up, we have the integrated screen. This one is a 2-part screen. It combines that first trimester screen, the one we just talked about, with the second blood test that's done between 15 and 19 weeks. Compared to the first trimester screen, it gives more accurate results for Down syndrome and trisomy 18. It correctly identifies about 96% of cases of Down syndrome and has about a 1% false positive rate. This one is different because it can sometimes detect neural tube defects like spina bifida. Next, we have the second trimester quad screen. This one is mainly done if someone did not want to do NIPS and they missed the window for the earlier tests. This one is done between 15 and 22 weeks. The second trimester quad screen is a blood test that checks for Down syndrome, trisomy 18, and neural tube defects. It's not as accurate for Down syndrome as NIPS or the integrated screen, but it still gives some information. It's about 80% accurate for identifying Down syndrome and has about a 5% false positive rate. Lastly, we have the fetal survey ultrasound. This is sometimes called the anatomy scan, the 20-week ultrasound, or other similar names. This is a very detailed ultrasound that's usually done between about 18 and 22 weeks. It looks very closely at the baby's organs and can find some structural problems that may be associated with genetic conditions. It is very accurate at seeing neural tube defects like spina bifida. This ultrasound also looks at the baby's overall growth and development and can sometimes tell the baby's sex based on their genitals. So to recap, what are the big differences between these tests? NIPS is the most accurate for certain conditions, but doesn't check neural tube defects. Because it's a newer test, it may not be as well covered by all insurance plans. The first trimester screen and integrated screen offer earlier detection than the other screens and are well covered by insurance. The second trimester quad screen is an option if you miss the earlier tests like first trimester screen and integrated screen. It's generally well covered by insurance. Each of these tests has its strength, and the choice really depends on what you need and what stage you're at in your pregnancy. If you'd like more information, talking with a genetic counselor can help you decide what the best option is for you. Now, here's the bonus: carrier screening. I call this a bonus because it's not directly about the growing baby, but it's about the genes of the parents whose DNA created the baby. This test looks at the genes of both parents to see if they carry any genetic conditions. What does it mean to carry a genetic condition? Being a carrier means that you have a gene for a condition, but you don't actually have the condition yourself. If both parents are carriers for the same genetic condition, there's a 1 in 4 chance that their baby could have that condition. Carrier screening checks for several really serious conditions. For example, cystic fibrosis, which is a condition that affects the lungs and digestive system, sickle cell anemia, which affects the red blood cells, and Tay-Sachs disease, which affects the nervous system. Carrier screening can be done anytime before, during, or after the pregnancy. You only need to do it once in your life for each reproductive partner. It's especially useful if you have a family history of genetic conditions or if you come from an ethnic background that has higher rates of certain diseases. So again, carrier screening looks at the parents' genes to see if they carry conditions that might be passed to the baby, whereas genetic screening looks at the baby for specific genetic conditions. That summarizes all the options for genetic screening and carrier screening. Thank you for watching. If you have any questions, please speak with your midwives and feel free to let us know if you have any requests for more topics for us to cover.